Good afternoon, all professors and students. I am怡均. Today, the topic I want to talk about is the changing face of the HIV epidemic in Taiwan, the new strategy for public health policy strategies. In 2005, an estimated 38.6 million people worldwide were living with HIV, and the rate of new infection is estimated to be 4.1 million per year. The uncertainties associated with the future of the epidemic are equally disturbing. Although Sub-Saharan Africa remains the global epicenter, rates of infection have recently increased in the former Soviet Union and parts of South and East Asia, including India and China, where hundreds of millions of individuals are potentially at risk. In 2005, some 8.3 million people were living with HIV in the Asian Pacific region, and 1.1 million people became newly infected in the past year. In 1984, after the first case of AIDS was reported, the Taiwan CDC began to collect case reports of AIDS. These case reports were forwarded to the Taiwan CDC and formed the basis for AIDS surveillance. The national surveillance data of HIV/AIDS and other related information, such as the determination of at-risk subpopulations for HIV infection, have been conducted by the Taiwan CDC in partnership with county-level surveillance programs. Surveillance is undertaken using the following information systems and studies. The HIV/AIDS reporting system is the main software of this report. During the past decade, several strategies for the prevention of HIV infection have been implemented. However, few studies designed to evaluate the effectiveness of such measures. So in this article, we describe trends, risk factors, and survival rates of people diagnosed with HIV/AIDS in order to inform national HIV intervention and prevention policies. We use national HIV/AIDS case surveillance data reported to the Taiwan CDC for the years 1990 to 2005. The subject of this study were all confirmed HIV and AIDS cases in Taiwan. We include only adolescents and adults, include children younger than 30 years. The Taiwan AIDS surveillance definition and its modification are modeled after the CDC USA. The surveillance case definitions for HIV and AIDS in this study have evolved as the clinical spectrum of HIV-related cases has improved. With the 1993 revision of the classification system for HIV infection and expanded surveillance case definition for AIDS among adolescents and adults, AIDS was distinguished from HIV infection without AIDS by a count of CD40 lymphocytes per microliter of less than 200, or a CD40 lymphocyte percentage of total lymphocytes of less than 40. In 1999, a revised case definition for HIV infection has integrated reporting criteria for HIV and AIDS in a single case definition. This table summarizes some definitions used in this report, including person with HIV, person with AIDS, the diagnosis year for HIV, the diagnosis year for AIDS, the number of people living with AIDS, late HIV diagnosis, earlier HIV diagnosis. We performed an analysis for 2 clinical periods, pre-HARD era and HARD era. Cases of HIV/AIDS were counted only once in a hierarchy of transmission categories. The data presented are estimates that have been adjusted for reporting delays and redistribution of HIV transmission risk information. And we use some statistical methods, including Kaplan estimates, Lorentz test, Hard's proportional hazard regression, a delay entry model for Hard. Result. From 1990 through 2005, the number of people that have been reported as having been diagnosed with HIV/AIDS are almost 10,000. Among HIV infection, 91% individuals were male. The median age was 32 years. Most resided in the northern region of the country, and 1.2 were sick workers. Among AIDS cases, 93% were male. The median age was 37.5 years, and 55% resided in the northern region of the country. According to the HIV transmission category hierarchy, the leading mode of exposure for men was MSM, and for women, it was heterosexual sex. The distribution of risk exposure among those with AIDS was similar to those with HIV infection. This figure shows the number of annual HIV diagnoses by risk group in Taiwan. The number of HIV cases diagnosis increased from 32 in 1990 to over 3,000 in 2005. By risk group, the proportion of individuals exposed by IDU increased to a large extent among persons with HIV infection. This figure shows the survival probability among patients with early and late HIV diagnosis in the pre-HARD and HARD eras. Related to the group with HIV diagnosis, the protective survival effect associated with being in the HARD era was stronger for both early and late HIV diagnosis group. Related to the group before and after the introduction of HARD, there was no significant difference in the protective survival effect associated with being in the early or late HIV diagnosis group. Conclusion. This data suggests a growing epidemic of AIDS among IDU in Taiwan. HIV intervention and prevention strategies, especially target IDU, are urgently needed to reduce the ongoing span of HIV infection in Taiwan. Overcoming the educational, legal, and financial barriers, and promoting the use of steroid needle by addicts unable to stop injection may be the most effective means of halting the span of AIDS epidemic in IDU. This is my reference. Thanks for your attention.